Good afternoon. My name is Dean Mazzarella, Mayor for the City of Leominster, and welcome. And it is a very rainy Tuesday afternoon, this April 21st of 2020, and lots of information to share with you today. What do we forget, Kyle?
Nothing. It's just shot needs to be
Readjusted, or readjusting shots this afternoon? Sitting up straight or something. Anyway, good afternoon, and thanks for watching. We are here at the Leominster.tv studios, and I hope you're able to watch on either cable or watch our streaming. I think I'm streaming. If anybody has any comments, things that we can help you with, by all means, please feel free to go ahead and, let's see. I guess that's us there. Yes. Where is the sound? Is there a sound? Okay. Anybody else having trouble with sound? Let's get this. Let's get this straightened out. Yeah. Okay. Anyway, I hope there's sound. All right. Where do we start today? We're waiting for the afternoon numbers to come in, but we will tell you that our Emergency Operations Center is still open. And we are at 978-534-7500, extension 5055. Also, if you'd like to volunteer at emergency management, by all means, let us know. You could call that phone number. Maybe you'd like to be part of a permanent part. We've had some people who have gone down to volunteer only to, maybe on a temporary basis to end up joining our emergency management center, finding a place for them to help out, and so we picked up some great volunteers in the process. Sound is good, okay. And also if you need something. So if you need food, if there's some issue that you're having, you need some assistance, there's nothing that we won't do to help you out. And I know that emergency management, those volunteers have been delivering food to the elderly, working with Ginny's Food Kitchen, and they have been helping out with them. They have been helping out delivering the food for schools, and so they are busy. They will make personal deliveries for the students that cannot get the school breakfast program and lunch program because of transportation problems. So if that's the case, we're standing by, right? 978-534-7500, extension 5055. And see what else we have to tell you today. The governor, I caught the press conference today, and there will be no school for the rest of the year. Pretty much what I predicted from day one, right? That's what we said. Where will this end? Everyone keeps asking me, where will this end? I don't know if it's going to end. So let's fast forward just a minute and do a couple different scenarios, because that's what we talk about here. Being prepared, not panicked. So let's fast forward to August. When August comes and it's time for students to go back to school, what happens then? Do we then, if the pandemic is still in effect, and even though the numbers are low, I can't help but to think that parents will still be concerned about putting students on buses. Same as I said about opening work back up in the bigger cities that rely on public transportation, whether it be trains, subways, buses. I think those are going to be some issues that people will be concerned with. And do we go to, as I suggested, maybe one of the options at the end of this year was, do we go to an A and B week, or do we go an A and B day where students come in for 3 hours, either in the morning or the afternoon, and we cut out things like gym and all the electives, and we teach to the common areas and the most important subjects that that particular student has. Do we get special needs students to then go to school on either A or B? All of those have been floated. They didn't happen, and now school is closed. So how do we address that now, right? I mean, that's going to be the question. So how do we go forward from here? The questions will come about recreation programs in the summer. Do we open the state pool, that pool that we have? Do we run outdoor programs? So what we may do is run outdoor programs, but obviously make them smaller in attendance. again, I'll say it, somebody can send me something from the FDA or the CDC saying that people have gotten this from touching something, then obviously that might explain why people are getting it, but this is a people giving people problem. So this is a distance problem, right? This really is. This is keeping distance. It's so simple at this point. It's keeping distance. So how do we keep distance and continue to open up the city, the state, and the country, right? I mean, that's going to be the challenge, right? I mean, that really is going to be it. And so we have these discussions, these what if, these possible alternatives every day of the week. And, have 500,000 people in the state of Massachusetts that don't have a check. And many more companies who are saying, well, if this goes on much longer, I'm not sure I can keep my employees. So I don't know how much longer this goes on. People ask me every day, how do we reopen? Well, if you're a business and, start thinking about even if this turns itself around and we slowly open, there'll be no magic potion that's going to return everything back to normal. So how can you kind of, sort of like restaurants did with takeout food, how do you sort of revamp that? How do you retool that, repurpose it, your business? So, and I'm doing the same thing with my own business, trying to think, how do we sort of retool ourselves? Because, we're selling things in many cases that people don't necessarily need to survive. People need food and all of those things. And yes, we are on Facebook. Somebody texted me, are you on Facebook? Well, get on Facebook. Yes, we are. Anyway, so those are all the things. That's not to take a side on any particular issue, just to say that all of what we do is to look at these different options, look ahead a week, a month, 2 months down the road. How do we align ourselves for our recreation programs in the summer? And how do we do that? And and we're dealing with students of all ages. On the other hand, there are so many families out there with students and children that have special needs. And what about when, let's do another scenario. What happens when when work starts to call back and say, okay, we need you to come back to work. And what do you do? Now, some people will say, well, what do you do in the summer? Well, listen, if you're a mom and you're a single mom and you're trying to bring up those kids and it's a struggle in the summer and now you've just added another 3 months to this whole process. And I hear from those people all the time. It's like, what happens? My work starts calling me back. I don't have daycare. I can't pay for daycare. What happens after that? So these are all the things that are circulating along, right? Streaming on Leominster, City of Leominster, Mass, if anybody having issues with this, viewing it in other spots. So yes, there are a couple other places that are sharing it on Facebook as well. So that's just to let you know your city government isn't sitting back and not thinking about the future and planning, not panicking, but planning for, what are the different scenarios as we go forward? Because let's see. You're streaming on Leominster TV, but not on Facebook. Okay, hang on, everybody. Maybe I didn't share this properly. I was getting yelled at on the way in. Okay, no, I was just having a discussion with them out back there. But anyway, how's that now? There we go. I'm pretty sure I forgot to do something like share this on my site. So we're back here, and if you missed us at the very beginning, we haven't given you new numbers yet because we don't have them. But hey, let's take a look now that everybody's, well, let me give a minute for people to pump up on my Facebook. But anyway, if you need something from City Hall, we are staffed at City Hall and other municipal buildings. We haven't shut down. We haven't backed off. We haven't cut back on any of our projects. Everything's still moving forward. Just go by Mechanic Street, see that park is moving forward. But all of our projects continue on. We are just working on a bunch of different scenarios for the reopening of certain businesses. I don't assume that they'll all just reach that May 4th number date, but that slowly but surely we'll begin to add businesses that they'll allow to open. We have an entire economy across the country, and I know, listen, not one person's death is worth it, but the reality is we have a whole country that's basically in a shutdown. So that's why we're going through all of these what-ifs. And, okay, now you see me on Facebook. That was my fault. I apologize. So we need to sort of look at look down the road at what our options are and will be. And, some of these events that we put on for the city are very expensive. So when we look down the road at things like, maybe the stroll, summer stroll, we looked at, and maybe we do something a little bit different than we have in the past. We will continue on with our farmers markets. Those seem to be more spread out as we looked at old photos and videos from our farmers markets. It looks like those will expand on, but again, we have different stations that people are, so people aren't always sort of squished into one area. And we're working on something at the end of July that will be a citywide, old-fashioned bargain day sidewalk sale kind of thing where there are businesses all over the city, so not everybody is limited to one particular area, and then maybe looking at things like dining under the stars, where we have different pockets of dining under the stars where local restaurants participate, but not 20 or 30 restaurants all at once, like the food truck festival or whatever. So all of those things we have to look at, right? This is your government at work. This is what you pay for us for. This is what you expect from us, that we're looking at these things, and we are. Okay, let's see if we can find. But I know that people will need to go to Leominster.tv to get, are people not seeing me? I don't know. I hope, yeah, they must be. Okay, hey, let's go to those slides, because I talked about it a little bit this morning. Oh, by the way, if you haven't heard, school is out for the season, right? Remember that song? School's out for the summer? Who was that? Quick. Who was it? School? Alice Cooper. You didn't know that? You did. Well, you got a mask on, I can't tell. School's out for the summer. Yeah, here you go. Well, anyway, it's out, and it's been out, right? We're in week 6. Yeah, here we go. Is Jer on here? Who's Jer? What do you have? Matt, this is not a dating site, okay? Who's Jer? All right, here we go. Let's see if we can get to that site. What happened to the monitor in front of me? I can't see that far. Is that off for good? Yeah, I can't see that. Is there any way to turn it on, Bradley? Bradley's knows everything here. He knows stuff that I don't, you want an audio question? Brad, why don't you do that show sometime? You guys can do an audio show, like Ask Brad.
That's our job.
No, but I mean, ask questions, call here. People can call and say, how do I hook this up? There we go. Let me just get to those other slides. This is as of Monday, but we'll update those in a couple of minutes. Hopefully we'll get those numbers. There we go. There are the daily and cumulative confirmed cases in the state of Massachusetts. So I'm going to sort of fast forward to my slides here so that I can see them, because that's a lot of small writing. Okay. These are confirmed COVID-19 cases to date. New cases are in blue, and whatever that other color is, cumulative cases by date. So it looks to me like it's all in blue, right? So starting back is, let's start March 19th with 72 cases. And then you can see, maybe you can't, but right around April 3rd, we see the spike of 1436. And then for some reason it drops, and it may have been because of testing, and it drops to 746, just randomly on April 5th. Then we go up to 2151, and it drops for a couple more days. And then we spike. And this is what I say, it spikes. And they tell us it hasn't spiked yet. They tell us we're in the surge. And all I'm trying to do is make sense of these numbers, because that's what the graphs are for, right? I mean, you can move around graphs all you want. But anyway, here you go. 2615 on April 12th. That's 8-9 days before. But then it drops for 3 more days. And then it goes back up to, it looks like 2262. But from there on the 17th, 18th, 19th, and 20th, it drops. So I'm just like you. I'm trying to understand it. There's that peak. That one that you see there that peaks out is at 2615. That's the daily and cumulative confirmed cases year to date. And that's April 12th when it does that. And then it drops for a couple days, which is not, I mean, listen, 3 or 4 days is no indication of anything. It's not any kind of a pattern. But when I hear everybody saying we're in the surge, we're dropping every day. These are the state's numbers. I didn't make these numbers up. These are the numbers that they're giving us. So these are new cases, and then the cumulative total cases by date is this other spike here. So they're saying, I see. So they're saying this curve is still going up, but the new cases are actually going down. Okay, so that's what's happening here. Is that little sort of curve that's going up? That little line is the cumulative total cases by date, and the new cases by date is in blue. So actually, the new cases are going down. Is that right? I think that's correct. Yes, it's pouring out. Okay, let's go to the next one. It's just fun to look at these, just to try to understand, because it's the data that really sort of drives their decisions. Everyone's making decisions. This is how they're doing it. So this is testing by date, and the number of tests and performed by date, and new tests are obviously in that blue, and then whatever that is, purple or whatever it is, cumulative tests performed by date. So new test and then total test. So here we go. So you can see that it's pretty steady. Again, 79.54 April 12th, and then it peaks here at 87.50. But then on the new test performed, we start to drop. So, you could take that for whatever you think it means, but here's cases by county. That gets a little difficult to sort of see, but here's what I can explain to you. Middlesex County, Suffolk County, Essex County, and Norfolk County make up, if you add up just 2 or 3 of those, not Middlesex and Suffolk, that's basically, Middlesex and Suffolk is basically metropolitan Boston, but Middlesex goes all the way to Air. And then you add Essex in there and Norfolk, that's responsible for about 60–70% of all cases in the state of Massachusetts. And you can see this whole thing really kicks into gear March 24th. And there we are with all of these other cases here. And they have them all in color, so it's hard. But you can go to, to the state's website, to Department of Public Health website, and see all of this in the same way that I'm showing it to you. These are daily and cumulative COVID-19 hospitalizations. And you can see on April 5th through the 6th and all through that area that, we were pretty, we were at 47 on April 12th. And then it spiked. It looks like another side of this here is that the number of hospitalizations seems to have shot up right there on the 13th. The 13th seems to be that number. That seems to be the day when either they started doing more testing. I'm not sure what happened, but it seems to be the day. And then from there, it's 161 cases new, and the total patients hospitalized by date. So the 19 cases currently hospitalized brings it to 3,804. So what they're doing is basically showing you everybody that's ever been hospitalized, but then they're showing you how many new cases there are, how many new people have entered into the hospital system. As I understand it from what I've heard, and if this is not correct, let me know, but from the people that I'm speaking with are telling me that most of the hospitals, in fact, I thought I heard the governor finally say it today, that most of the hospitals are in decent shape and things are under control. And that seems to be the message that I've heard here. But that doesn't seem to be the case in other parts of the state. So it really does go to a state-by-state area. So the last data that we got, I'm going to take a swig of water here, showed Health Alliance at 22 patients total, suspected and confirmed, including ICU. And then they shift off to the next column, which is 6 hospitalization COVID patients in ICU suspected and confirmed. So what it looks like is some of these hospitals have 130 people in them, but they're bigger hospitals, 248 at Boston Medical. Then you get to places like Boston Medical with 64 in the ICU. So it's all over the place. But again, the state's Department of Public Health has this whole dashboard. You can find all this information. I'm just sort of circulating this with you, discussing it with you. And then there's our daily and cumulative deaths. Again, the total amount is at 1,809. And again, you can see that spike around April 13th. That really seems, for some reason, seems to be the day, everything that they did, the most amount of testing, They had the most amount of people in the hospital. They had the most amount of people in intensive care. That's what it seems like. Let's go, and if you want to find out who this is impacting, the average age of a person getting the virus is 54. You can see there's still people 0 to 19 getting it, 20 to 29, 30 to 39, actually spikes up to 56, 36, and same thing with 40 to 49, and then it goes up about 1,000 when you hit 50 to 59, drops a little at 60 to 69, but really that peak is that 80 plus years old, and it seems to be those that are affected, that 50 to 59 and 80 plus, and then the rates per 100,000 confirmed cases by age group. Again, once you get to that 80 plus, everything is pretty consistent from 20, 30 years older and on, and then you get to 80 plus, and the average age, again, is 54 years old. Hospitalizations, again, the average age seems to be 68, and again, you can see that 80 plus, it goes up in steps on the age groups, but then when you get to per 100,000, you get to the age 80 plus group, and it just sort of spikes. Deaths and death by rate by age group, there you go. I mean, that says it all right there, right? You look to the left, and it's almost insignificant in those that are 20 to 30 to 40 to 49, and a few under 50 to 59. But after that, it goes up slightly, and then even the 70 to 79, but boy, it just goes right up. It's 10 times those of 50 to 59. And then if you look at the rate per 100,000, no comparison on the right-hand side. So the average age of deaths confirmed in Massachusetts seems to be 81 years old. And this is by county. I'm not going to go through this because it's difficult. No, I guess it's not a bad slide at all. These are really good. Thank you, Wendy and Brad and everybody here at LTV for putting this up. This is helpful information. I don't know. Fran, that's a good question. We'll have to look at those numbers to see out of that, those that are 80 plus, then how many are in nursing homes or how many of those were in the soldiers' hospitals. I think one of the things that everyone will agree to that has been learned out of this process is you've got to thin out those nursing homes and military hospitals immediately. And that's something to learn not only for this, but how about cold season and flu season when you have these issues? Maybe that's that's something in the future that we should look into, is sort of putting that out there, that it's time when it gets to flu season, you've got too many people in one area and it could be carried so quickly and they're most vulnerable. Maybe it is time to thin that out and put some, maybe transfer them to hospitals. Okay, let's see. You can go, yeah, death rate by county. We did that. Let's get to the next one. Death and sex, previous hospitalization, and underlying conditions. So basically, by sex, it's pretty quick. Nobody can say men are getting it more than women. Deaths with a previous hospitalization. So these are people that have been in the hospital before. The highest is about 61%. And then, this is really telling here, deaths with underlying conditions, so pre-existing conditions. And yes, by far, 97.5. So Fran, I think you might be right. This might be the case where it is, people that are in nursing homes, people with serious illness, and then they get this. But still, how do they get it, right? I mean, that doesn't mean that just because you're 80 plus years old, you're going to get it. It means you got it, and you have a difficult time with a pre-existing condition or underlying conditions to fight it off. But the real question is, how did they get it? Did it come from the outside? Obviously. So those are all things I think we got to learn from no matter what. And also cases, hospitalization, and deaths by race. It does show some, race and ethnicity in here for Hispanics. About, it looks like 20%. Let's see. Non-white and Hispanic, so the numbers are pretty high when you get to some of these areas. Non-Hispanic and others is at 42%, so it certainly does impact that area, and it's almost consistent right when you get into deaths, hospitalizations, and total count. So those numbers are high. So now you get into the capacity. You get into the capacity here on what is available and what isn't. And total beds in Massachusetts, 18,000. Boston alone is almost 7,000. Metro West, 2,400. Southeast part of the state, 2,900. Northwest, 1,600. The West, 2,300. And right here in central Massachusetts, we're at 2,100. So that's where we're at. And it just, the slide shows non-ICU beds, ICU beds. ICU beds right now occupied, it looks like 14% seems to be the average. Although if you get into the Northeast, it's more like 6%. And in Central Mass, it's 10%. So you can see it's 14% out near the Boston area. So here we go with the daily nursing home, rest home, and assisted living residents testing program. So here's where they are testing. This is the facilities up to date. Total unique facilities, daily tests completed, total tests completed to date, which is around 10,000. Test ordered, and then total test ordered to date was around, again, 15,000 that are being tested in rest homes, assisted living, and et cetera. And I'm sure that includes military. Testing sites in this area. If you haven't heard, you do no longer need a doctor's note, but you do need symptoms to go to Health Alliance. They're open 8 to 4. Here are the symptoms if you have a fever above 100. Other symptoms like a cough, new or worsening shortness of breath, loss or change in smell, confirm exposure to persons with COVID-19 and symptoms. If you're experiencing at RELIANT, if they say if you're experiencing respiratory symptoms, coughing, fever, shortness of breath, call your RELIANT doctor first. Following physician advanced practitioner orders, a nurse will help to determine if you are eligible for the testing. If testing is recommended, you will be scheduled to visit one of our outdoor drive-through testing clinics, and they have one here in Leominster. Let's go here. Some people asked about other communities. These are the ones that we have as of the 15th. But again, we'll be updating these as we approach. But a couple that jumped up. I mean, look at Chelsea. Chelsea's population, 39,000. But remember, a lot of those people work in, the residents work in the service industry. They're the ones that are at the grocery stores and, work in essential businesses. And it's high. Revere at 470. 444 in Everett, which they basically had just a whole entire lockdown of this whole city. And there you go. It starts off in Amherst. We're third or fourth to the bottom. And seems to be all of those communities that are at the top of the list, they are pretty much are metropolitan Boston, right? Once you get into those areas, obviously not Holyoke and Methuen, but when you get into Braintree and Randolph and Everett and Revere and Chelsea, and these are communities of similar size population of Leominster. There's our distribution of personal protection equipment. And we are the host community here in Leominster for the area, and they have been, I don't know, Jim LeBlanc told me this morning, I can't just, they ran out yesterday, and they thought for sure they had enough. So anyway, they came back today, and they'll be coming back. But anyway, we've been fortunate to have businesses in the community to be able to furnish us all the way through the process here. So we had Tyvek suits and gloves and masks right through the process. So we've been pretty fortunate here. Have they disclosed how many hospitalized cases are critical and on ventilators and which ones are stable? No, they haven't broke that down. We do have a conference call every day with the hospital, but from what I hear, they're doing a great job up there at Health Alliance, but they are proactive. They're working as a team, and from what I heard, and if I'm incorrect, you can private message me. I'm not going to share your name or anything, but it looks like they're in decent shape they're considering. Here are some of the things that we've got to think about, right? I mean, the transfer station's closed on Saturdays. We had to cancel our recycling day. And the thing is, what we might do from here on in is actually have people schedule, try to do it so we keep our social distance. And we have stations rather than such large groups of people gathering. And it's very efficient. But have people pre-register, and that way we'll know. It's costly to have some of the events that we have. So if we do schedule a, a recycling day and nobody shows up, then it just costs us a ton of money, and that money can't be redistributed. We've already had to pay that out, so we can't actually have another event. So we want to make sure that if we are going to have an event, that we are sort of space ourselves out, right? And then, and then move along with social distancing and some of our events in town. Taxes are due May 1st. If you could pay, please. I mean, it's going to be a big help to us if we can pay our bills, right, like everyone else. And if you can't, we'll go to June 1st. If you've got other bills that came in after March, where's that date? March something, middle of March 10th, and you've got those bills have been paid, please, we'll waive all the fees and fines up into June 30th. How can you pay your bill? Well, we come up with some neat ways, right? You can either mail a check to us, you can get on our website, leominsterma.gov, and you can pay online, or you can come to the top of the stairs, and at City Hall, we have a mailbox there, and we will let you pay your bill that way, right? Just don't leave cash in there. Burning permit. Today's not a good day for burning, but you got till May 1st to burn, but there are unsophisticated but logical, general, everyday, common sense rules that apply, like don't start a really smoky fire so that you smoke out your neighbor, because you're going to get a call. We're going to get a call, and they're going to make you extinguish it, and that's not going to be any fun. If you're 75 feet from another structure, fences and all that, if you don't think that happens, it does. So all of those things, but you do have to call the fire department between 10 and you can't, burning permit is between 10 and 4, but you must call the fire department before 2, and yeah. No, you could call them earlier than that. All fires have to be ignited prior to 2 p.m. and extinguished, no, so you can't light them after 2, and they have to be put out before 4, okay? So all common sense things. Don't be one of those neighbors who starts the fire and the ball blows over to somebody else's house, and then you get mad because they're upset because their house is filled with smoke and the smoke detectors are going off or whatever might be going on. So don't be one of those neighbors, right? So our big push. If you know a student in Leominster, and it doesn't necessarily have to be a Leominster school student, we have people in the community and outside the community that have made financial donations. They've done so because they believe that not all education is online and not all education is on the internet. But it is a wonderful way to learn and to explore, and that's what it's all about, right? And to follow your passion. And lots of times I will speak to students and say, so what's your passion? And they'll kind of look at me strange, but eventually we'll get there. When I explain to them, well, your passion, something you're really excited to do. Well, you could pursue those things on, when you're connected to the internet, and not that you can't do it with a book, but the library is closed, and a lot of it is online, but you can't get online unless you have the internet, which Comcast Essentials program is offering. And then if you do know a student or a family that does not have a mobile device, that electronic device that hooks up to the internet, you let us know at 978-534-7500, extension 0. We keep it very discreet, but we do ask some questions because we have to verify need, and then we will pair you up with an electronic device. So over at Infinite Design, Russ and Kim have volunteered all of their time, and they have been refurbishing these computers, first by eliminating all of the memory, so you don't have to worry about that. And once they get rid of the memory, they're going to repurpose them so that kids will be able to connect. And now that we're out for the rest of the year, it's going to be mostly March, and then April, and May, and June that students will be out. So we're looking at 3.5, almost 4 months. And there is no chance that we're coming back this year. So let's just plan on that, and there's so many options for learning online. And let me just say this, we should have learned something about this process. One is immediately when we have a flu outbreak, colds, whatever it might be, is we've got to help nursing homes, soldiers' homes, wherever those rest homes, wherever they might be, and we've got to thin them out to help them and get them into hospitals. And if that requires Medicare, Medicaid, government assistance, then we've got to do it. Leaving them there and letting the nursing homes fend for themselves the way they've had to at the beginning of this process, and those military homes, just doesn't cut it. The second thing is we have to build a national program. I'll go through the slides while I'm ranting. We have to build a national program that is set up. We talk about resiliency and sustainability, being able to survive through climate changes. Heard on the way in that they were giving out in the Bronx, there are tornado warnings out in the Bronx. I mean, see this weather? I mean, it is just rain event after rain event, wind events. I mean, clearly something's going on, but we've got a plan, and we haven't planned for learning through climate change. We need to set up a system. There's no reason at 10 o'clock tomorrow that a second grader in every part of this country can't click on to one spot and watch a teachers teach English second grade. There's no reason, none, not for this country, not to be able at 10 o'clock in the morning to tune in somewhere, click on with millions of other kids across the country and learn algebra or learn history or history of American minorities or ancient history, any of that, at any time of the day, 24/7, this network in this country needs to be set up so learning can continue not only in the classroom, but when the student goes home, when the student's on vacation, when the student's on summer vacation, when the student is ill. So they started to get going on this when they had students that couldn't learn because they were home ill and they couldn't come to school and they were trying to recover. So they started to set up this system, but never really sort of expanded on that. So there's no reason that learning can't continue with just a click and a point, right? So those are my two recommendations thus far. They're just my own two cents here, and hopefully that will happen. But here's every city and town across the country trying to do distance learning or online learning in a different way. Everybody's using a different platform. Some are using Chromebooks. Some are using Zoom. Some don't like Zoom. There needs to be a national program set up. And you know what? You could have somebody come on and talk, a biophysicist, the best in the world, talk to students if they're interested in it. You could have business channels that are set up for students who want to study and learn to be entrepreneurs and to own their own business. One of the things I hear from students all the time. How about music, right? I know a number of people who are teaching music online. It seems to be working well. I know that almost every single musician in this country is not working right now. You could easily get them on at 9 o'clock at night or 9 in the morning or 6 in the morning, put them on and do lessons with students who could be watching from anywhere in the country and maybe in the world. So that's my rant for that. Those are two things that I will continue to push for. And yeah, you'll hear more about it. Hey, let's go. So they tell me new grocery store guidance. So 40% of the store's square footage. So you wait in line to get in, there's less people. But I'm just going to do my own little simplified boot camp today, and that's stay away from people. Even if you have a mask, right? A mask is only like one of those things that came later. Like, yeah, it doesn't hurt to have a mask, right? Because it does stop things from coming out of your mouth and it stops them from getting them if somebody, but that means you're already too close. If you need a mask, that already means that you're way too close. So stay away from people. Stay away from people, and you have a pretty good chance here of not getting this virus or a cold or another strain of the virus, of another virus, right? So this is cootie protection. Remember in school? Did you have that in school? Cootie protection? Yeah. Cootie protection is simply staying away from people, right? Just because you have a mask. No. Somebody's in aisle 6, you go to 7. If there's somebody in 7, you go to 12. Go stare at the Frosted Flakes for a little while. Read the bottom, turn around, go to the magazine section, read some magazines, or read the back of the cereal boxes, and then when there's nobody in aisle 6, you go back to 6, or whatever it is. It may take a little longer. One thing I can guarantee you is that supermarkets are setting up, frantically setting up for darkened stores is what they call it, and basically that is where they're fulfilling orders. So they have a whole grocery store, And in that grocery store, they pick orders. And right now, how it's been is you go to Hannaford picks the order in the store. And that's not the way it's going to be. It's going to be sort of a darkened supermarket that you can't see in. There's nobody there. There's nobody in line. Nobody shops there, but they're picking orders for you. And then that is either orders that you pick up or orders that will be delivered to your home. Trust me, there'll be a surge of that. Hey, let's get over in case you are an artist or you make your money somehow or another through the arts. You might be eligible for a $1,000 grant, and that is through massculturalcouncil.org. Stimulus checks are beginning to come in. That's good news. And if you have automatic deposit or direct deposit, then don't worry about it. They'll automatically send it to you. Have you gotten yours? Some people haven't got theirs yet, which makes me either think they don't have direct deposit and they'll have a check mailed to them. But those that do have direct deposit, and then also I'm told if you use a certain software to do your taxes, they might be able to send it to you that way. So a couple different ways, but if you haven't received it and you'd like to receive it and you're not registered as direct deposit, you can by just going onto their website and they'll help you out with that. And you can register and then they'll send it to you. And if not, sit back, as they say, the check's in the mail. So here we get to those businesses. It's been a good 6 weeks now for businesses. And I know people will say, you can live without a haircut. But how many of those people who are running those businesses can live? And how long can they survive financially with being out for 6 weeks? And we're not even sure how long this is going to be. May 4th seems to be the magic number, but we haven't heard anything yet on that. So if you're one of those businesses, and I heard that the House passed the funds today, and if that's the case, then by all means, get ready, because you want to be on your computer, your mobile device, ready to apply for the next round of funding. And we'll do a breakdown of that funding. And also, we'd like to get, if you're watching today, Jeff Roberge over at Mass Hire, sometime we'd like to get you on either Wednesday or Thursday at our 4 o'clock session so we can go over what's happening with Mass Hire and unemployment claims. And he was saying there's so many claims coming at them. They're trying to process them as fast as they can, but there's a couple hiccups along the way, and we can certainly speak to that. So if you're one of those small businesses and sole proprietor, you want to go to that new site. Let's see if I can find it. It's mass.gov/ is it PUA? Let's see. I'm looking. I may have already passed it up. Let's go to, I know somebody will post it here. I had it here. I have so much stuff here. Let's go to the numbers here. We do have the numbers for today. Let's see. We are, Leominster active numbers are 65 cases, 49 off, for a total of 114. We were at 58 active cases yesterday and 49 off. So we've gone up, wow, that's a big jump. No? Oh, okay. We've gone up 7, that would be 7 cases that we've gone up today. That's probably the biggest jump that we've had at any one particular time. And then so we're at 114 cases, and that's up from 107. So what that means is, from when I showed you that graph, from the very first day that we started keeping track, there have been 107 cases, 114 cases total now. That's from the beginning to the end. And out of that 114, there are about 50 cases off now, 49 cases off. So let's see. So these are today's cases from the state. 41,199, so basically 42,000. And Worcester County, it went up 3,341, so that's up 162 from yesterday. Total testing is up about 6,000 from yesterday. That may be why we've seen the increase, and that's up 17,000 total tested, 175,000 people have now been tested. And again, that's up 6,000 from yesterday. And deaths have also gone up 152. And that's up to 1961 now. And yes, so those are the numbers for today. I wanted to hang in there, and so I knew people were interested in those numbers. We are still picking up. Let me go back to my page here, if you bear with me. Let me go back to our slides here, if I could, and we will go to business questions. The best resources are the Chamber of Commerce, SBA, and you can go to our website, leominster-ma.gov, and we have a host of links that you can learn from. But you know what? We'll get guests on here to try to help you out. We are trying to get, 114 cases in Leominster total. That's up from 107. But there are 49 cases off from that. But yeah, that's it. So business questions, you could call our office, 978-534-7500, extension 0. We'll get you some help. Tomorrow's supposed to be a nice day. Yard waste and waste pickup. April 6th through the 30th. If you mail us a picture, we've gotten some so far. That's a good thing. Rake them up, get them in those bags, take a picture, and send them to us. And you might be a winner. So far, we have, let's see, the Claw Shop. We have Global Gym, Central Flag, American Harley-Davidson dealership. So we have gifts for you for being the person or the family with the most amount of leaves. Veterans projects, I know Bruce Coulter was out there. These are those flat markers that are there for military. If you could go to any one of the cemeteries and you see these, many are overgrown, you just take even a butter knife will do it. You just trim around it, take a spade, a flat spade if you have one. I'm sure you have other tools that will do it. You just trim around it, take that debris with you, throw it in your compost, and we will be very thankful. We have Memorial Day coming up. Again, we're asked, what we're going to do for Memorial Day? Well, it may be a small contingent visiting the cemeteries, but every Memorial Day we visit the cemeteries, and maybe we can invite guests in at this particular point. Maybe they'll have to be staggered, but I know myself, we'll get a small group, maybe one person representing every branch of the military, so we'll keep it under 9, and we will keep our social distance, and we will visit the cemeteries. Other than that, I can assure you. What more, I can't tell you exactly what, because again, we don't want to get large groups together, and we don't know where we'll be at the end of May. So we'll keep that as an open, is it DUA? Okay, it's DUA. So it's mass.gov/DUA. Yep, there it is. mass.gov/DUA. And that's for business related. So you should go there. If you're self-employed, sole proprietor, you're a plumber, electrician, it's just you own hairstyling, you're a barber, whatever it might be, one-person landscape operation. I'm not saying this is just strictly to these areas, but there are many, many more. So you should go to that website and check it out before the money runs out, okay? Let's get to boot camp. Everybody ready for boot camp? Reporting for duty? What happened to boot camp? There we go. Dr. Mazzarella says, assume everyone has the virus. Assume everyone you come in contact with has the virus. Assume you have the virus. Assume all surfaces that you've come in contact with have somehow or another been compromised. Soap and water and hand sanitizer. And a mask is preferred in case you do get too close. What about flag planting? Not sure yet how we're going to do that. That's a pretty remote thing. Again, this is we give this to other people virus. If you stay away from virus, if there's 6 people in a cemetery and they're all at different parts of the cemetery, then the chances are 0% that they're going to give it to somebody else. Takeout delivery. Hey, listen, these restaurants that are participating are so thankful. I hear from them all the time. They are so thankful that you're supporting them and their business, and it gives them a chance to hang in there. And so thank you. From them, from me to you, from them. Senior shopping, off-premise sales of alcohol. The restaurants that are certified and approved can sell you alcohol from midnight, from noon to midnight. They have to sell it in limited volumes, but the package has to be sealed. It has to be delivered by somebody 21. It has to be received by somebody 21, and it has to be accompanied with food. And yes, our parks are open, and we have had very few problems. I won't say we haven't had some, but we've had very few. And if people can continue on that path, no pun intended, we have 26 miles of trails and plenty of parks for you to explore. How about going over to Prospect Park? There's hiking trails in there, mountain biking. Yeah, all those things are there. Are yard sales going to be able to happen? I don't know. Well, that's another area that we're sort of keeping that open, right? If you do anything with common sense, then it's doable. So we just got to figure out how to do that. I know people will be anxious. Listen, at some point, you could already tell. If anybody watched the governor's press conference today, I told you. This is just human behavior. It's nothing more than when I talked about how I compared this to the 2015 winter season, when we all reached that point where we had had enough. We were just had enough. And I'm not saying snowstorms are equivalent to people getting sick and deaths. I'm just saying it's human behavior that we go through phases. And if you watched the governor's press conference today, you will see that the topics and the subjects that the press is now asking is really starting to change. And people wanting answers like, is May 4th the number, the date that things are going to start to open? What about schools? What about distance learning? What about when's the rest of the state going to open up? Are we going to have this? Can we expect this? And so every day now that there's a press conference, the press is going to start to ask those other questions. And that's because it's just human nature. And that's why I said week 5 and 6, we really need to have patience with each other, but it's hard to have patience if you're unemployed and the bills are stacking up. I get that, right? But it's also hard to have patience if you're ill or you're watching somebody that's ill and they're in the hospital or intensive care. You can't visit them. You can't go to a nursing home to visit your loved one. So all of that is circulating, and those are all the things that the governors and the lieutenant governor are sort of having to deal with. I'm surprised at the amount of people not wearing masks to run into CVS, grocery stores, et cetera. And that's what I said. I said, you know, what's going on? Oh, we're running out of time. Already? I ranted on for that long? Pretty good. Yeah, but listen, you stay away from people 8, 10 feet. I stay even further. And if you do, you're in good shape, right? It seems like people are mostly responsible to get their own mask on their own. I hope to see many people. Yes, you know what? If you need a mask, let us know. We do have people making them, and I know they want to share them. We do have some at City Hall, but I know there are some groups out there making them. If you are making masks and you want to leave them at Emergency Management at 37 Carter Street, we will then recirculate those into the community. That's up to you, though. I know some people like to personally hand them out. If you want to put your name on them or your organization, that's fine as well. And yeah, so good things. If there are no other questions, and we've got to run because we're on sort of deadline, because then we repeat this whole thing over. So we're doing okay. We've gone up today 7. We've gone up, no question about it. We've gone up, but testing is more plentiful. And I think what it looks like is hospitals' volume is down, or at least controllable. But I think what we're beginning to hit are the people who have no symptoms. They have no symptoms, and maybe they're being tested for I don't know what reason, but those are people, that is the most dangerous at this point, because they're out in the community thinking that they don't have the virus because they have no symptoms, and they're circulating out in the community like nothing's happened. So that is, I think, the danger part here in week 6. Okay, hope I've helped. Keep the feedback coming, things that you want us to address on here, but we're out of time. Remember, be nice, be helpful, be kind, be well.